Do you support expanding Medicaid in Kansas using federal ACA funds? I do believe that ship has sailed, but like...
I still would support it,
yeah.
yes.
What should the legislature do to address rural hospital closures and healthcare access? How would you expand access to mental health services across the state?
Yeah, mental health care is really important to me. And my wife runs a mental health recovery center. So it's something that our family cares about deeply. But I think healthcare overall, which includes mental health, is critical. I would expand Medicaid to include the 150,000 people that are currently not on it that need to be, and that are eligible if they lived in a different state. Those people need coverage. It's sad that we haven't done that. I serve on the Konza Prairie Community Health Board, and that's a federally funded community health center. Most communities have one that they're connected to, and it's a great resource for us. It's a sliding scale, so you pay what you can, and it's a discounted rate because of the federal funding. They have dental and they have mental health care. So I think just making sure they have what they need, and what they're needing, what they're running into is shortages in doctors and nurses. So what we can do to help with healthcare is really beef up some of our investments into the training, the workforce training, either at the universities, the Regent universities, or community colleges, and then also offer like those incentive packages that pay off your loans if you go and work in a rural area,
to keep them here,
to keep them in, to get them to go to the rural hospitals, because the rural hospitals can't survive without the actual staff.
People, yeah, they have plenty of patients.
Right.
And they need the staff. I think that this is something I was going to say earlier about the minimum wage and just different things like that. If we don't, when you have every state around you doing a higher wage, we're going to lose people that can just move right over there. They don't even have to go that far. They can still see their family, right? And so we're losing, they might come here and get trained, but then they're leaving because they can get a higher wage right across the border. Why not go over there?
We need to be competitive.
We have to be competitive in not just trying to attract businesses. We need to be competitive in not just attracting families. We do have a big push to try to be attractive to families, but just to keep the people here, keep the kids here, keep the college students that come from all over the world to go to college here, staying here once they're done. Because we're educating them, we're using the infrastructure, we're doing all this stuff, and then we're losing it.
We're losing that investment.
We're losing the investment in our people when they leave the state. So, a lot of these factors that we're discussing here are decision-making factors when people are trying to decide if they want to stay in a state or leave a state. Just the job availability, and then how much I'm going to make. Those are the two.
Right.
Where can I go? People are leaving the country that are nurses and stuff to go over to Canada and get sweet deals. So
we got to find incentives to keep people here, or to get them to go to rural Kansas.
We're losing our talent.
Yep.